Hi, everybody. So we are going to discuss the central nervous today. Basically, our focus is going to be mostly on the brain, and we are going to discuss spinal cord in less detail than we would do for brain. So let's go ahead and get started. So when we're looking at the brain, the main structures of the brain are identified as cerebrum, diencephalon, brainstem, and cerebellum. So I'm going to show you these structures on the picture first, and then we're going to come back in terms of names in just a minute. So when we are looking at the brain, the largest part of the brain is what is depicted in this kind of yellowish color, and that is identified as your cerebrum. We're going to spend a significant amount of time looking at the cerebrum and the breakdown of the cerebrum and some of the essential functions. In the posterior aspect of the brain, you have this orange structure, which is called the cerebellum. Deep inside the brain, you have this purple structure. So again, kind of look at it, it's a little bit shaded, which means it is deep into the brain. And it is depicted as a larger structure here called the diencephalon, which is actually made up of thalamus and hypothalamus. So thalamus would be this kind of an oval structure you see right here. And then hypothalamus is this little triangle that hangs right underneath it. Again, understand the word hypo means below, so hypothalamus means below the thalamus. You can also see there is another thing that's hanging off of the hypothalamus. This is called the pituitary gland, and that is producing a lot of hormone, and it is associated with both the nervous system as well as the endocrine system. Coming off of the brain, you have literally what we call the brain stem. This structure right here is 3 sections, one right here, which is the same texture depicted right here, called the midbrain. This kind of a bulging structure you see right here, called the pons. And then the extension of that is the medulla oblongata, which continues to become the spinal cord. So going back to the previous slide, you can see again cerebrum. It's made up of 2 hemispheres. We'll talk about that in just a second. Diencephalon composed of the thalamus and the hypothalamus. And brainstem composed of midbrain, pons, and medulla oblongata. And then again, cerebellum sits on the inferior posterior aspect of the brain. Now, when we start looking at the brain, the smallest structure, I should say, sorry, at the youngest age, we have what we have in the embryo, structure named neural tube. So neural tube is basically a structure that's just a line. You can see this right here. All it is just basically a neural tube. Now, fascinating concept is that within the first 4 weeks of embryonic development, you go from that single neural tube to a very visible structure with a lot of folds, which we identified as primary brain vesicle. And within just 1 week from that, you extend that to a structure called secondary brain vesicle. And then secondary brain vesicle extends to become what we identified as adult brain. So let's take a look. So neural tube, primary brain vesicles, and then you have your secondary brain vesicles, which develop into the adult brain. Now, what I do want you guys to know is name the 3 main primary brain vesicles, which are prosencephalon, or forebrain, mesencephalon, or midbrain, rhombencephalon, or hindbrain. Now, I don't need you guys to know what those secondary structures will form. So these names are not necessarily what I'm looking for. However, I do want you guys to know that when we're talking about primary brain vesicles, prosencephalon, which is also your forebrain, more superficial aspect of the brain, eventually develops your cerebrum, which was the largest part of your brain, as well as the diencephalon, which is the thalamus and the hypothalamus. What we identify as mesencephalon will develop your midbrain. So midbrain literally develops the midbrain. And then rhomboencephalon or hindbrain forms your cerebellum, which sits on the back of the brain, as well as your pons and the medulla oblongata, which is the last two parts of your brain stem. And again, it continues to become your spinal cord. So if you guys look at your slide, you can see that information depicted here. Again, prosencephalon is forming your cerebral hemisphere, which is the cerebrum, and your thalamus, hypothalamus, as well as your retina. I don't go into retina because it's not something we have discussed so far. Mesencephalon forms your midbrain, and then rhomboencephalon forms your pons and cerebellum, as well as your medulla oblongata. Now, when we look at the brain in terms of the neurons, we have a division called gray matter versus white matter. Gray matter is basically depicting anything that is short or non-myelinated neurons, basically the absence of your oligodendrocytes that forms the myelin sheath in terms of insulation, as well as the cell bodies. So anything that is identified as either short non-myelinated neurons or any part of the neuron that's identified as the cell body will be categorized as gray matter. The reason we call it gray matter is because there is a really different color in terms of, if you look at a brain, you can see differences in color when we look at the gray matter versus the white matter. And I'll show you guys in the picture in just a second. Now, white matter on the other hand, is basically depicting the myelinated axons. Again, if you're talking about central nervous system, just kind of a reminder for you, the cells that are going to create these white matter myelinated axon would be your oligodendrocytes. And their job is to basically, again, create these long axons that allow for a fast conduction of the electrical impulses in the neuron. So if you look at this picture, again, the picture I'm showing you here is a frontal cut of the brain. So this is the cut you see right here. So notice the edges of your brain has a different color right here. And then underneath that would have a different color. So the difference in color you're observing is depicting gray matter versus the white matter of the brain. The edges, the more superficial aspect of the cerebrum, would be your gray matter, and the deep, more internal structures would be the white matter. Please do note that you have secondary gray matters deep within the white matter. So these are structures right here, what you'd be depicting right here, which is the same thing as right here. These are, again, gray matters deep to the white matter, and they're referred to as the basal nuclei or your brain nuclei. Now, one of the structures that we talked about, or one of the concepts that we talked about previously, was a fluid that is found around the brain as well as within the brain, called the cerebrospinal fluid, or CSF. This is something we discussed last time in our introduction to the nervous system. So cerebrospinal fluid is a fluid that can be found, and I'm just going to show you this. Oh, sorry, I gotta go back. So it is a fluid that is found in the either the cavities inside the brain or inside around the brain within the layers called meninges. The goal of this fluid, this cerebrospinal fluid, is to first provide some level of protection for the brain. So the protection is found in form of cushioning the brain. The way I always think about this is, if you have a can and you place a ball inside of that and you shake it, then the ball is going to bounce up inside that can pretty easily. And if that was your brain tissue, it would have been scarred pretty fast. However, if you fill the can with fluid and then place the ball inside, then as you shake the can, the ball still moves, but the movement would be much more gentle compared to when that fluid is absent. So the buoyancy of the brain helps basically your brain float inside the fluid and protects it against the blows and jolts that are as a result of the external trauma. Now, does that mean that your brain is fully protected just because it has this layer of fluid around it? And of course, the answer would be no, because if that was the case, then you really wouldn't get concussions, hematomas that are basically as a result of trauma. If the trauma is severe enough, even if you have fluid around the brain, it will not be enough to protect you. The fluid, cerebrospinal fluid, also provide nourishment for your brain and the spinal cord. And in some parts, it acts as a tool of communication. I don't go into details about this, but the first two are pretty self-explanatory. Again, protection and then providing nutrition and nourishment for the brain and spinal cord. Now, we said that cerebrospinal fluid is found around this 3-layer of protection that found around the brain and the spinal cord called meninges. Now, looking at the meninges in a little bit more detail, they are found again around both the skull and the spinal cord. And the layers going from the outside to inside are referred to as dura mater, arachnoid matter, and pia mater. So dura mater is actually a thick double layer membrane, which is identified as a fibrous layer. There is a gap between these double layers called the dural sinus, and that gap is where you have your blood vessels draining from the brain and eventually empty into what we identified as a jugular vein that sends the deoxygenated blood back into your heart from your brain. So looking at the picture, here is your skull up here. Here is one layer, and here is the second layer of what we identified as dura mater. And what you depict in blue between these double layers is your dural sinus, which again, where you will have the fluid, where you have your blood collected into, eventually drain into the jugular vein. Now, the second layer that we have is referred to as the arachnoid membrane or arachnoid matter, which is this membrane right here. And the deepest layer which we have, which is the third layer, the innermost layer, which literally lines the brain. So if this is your brain tissue, the layer that lines the brain is called pia mater. Now, between the arachnoid matter, which is the layer right here, and the pia mater, which is the innermost lining, you have this space right here called the subarachnoid space. Subarachnoid space. And this space is where you can find the fluid we identified as cerebrospinal fluid. So in an exam, if I ask you guys, where can you find CSF around the brain, your answer should be subarachnoid space. And that subarachnoid space is between, again, your arachnoid and your pia mater. And where I can find your dural sinus is between the double layer of dura mater, which is the outermost lining of the meninges. Now, you probably all have heard of the medical condition called meningitis. Meningitis is literally inflammation of the meninges that is depicted here. So you have the 3 layers right here. And if these 3 layers are basically swell up as a result of either viral infection, bacterial infection, fungus infection, parasite, then that can cause brain to inflame as well because of its close proximity, brain and the spinal cord actually. And if it's not treated, and in many cases it is not treatable, or the damage is too widespread in terms of nervous system that the person cannot recover. But if you are to diagnose somebody with meningitis, what they do is a process called spinal tap, which is depicted in a picture right here. So they could either put the patient in the lying position, or they have the person sitting down, and they go between the vertebra and grab some of the cerebrospinal fluid that flows around the spinal cord. And they are looking for any type of infective agent, which could be, again, viral, fungus, or bacterial infection, and lower level of sugar than expected. Because if you have an infection, that infecting agent is going to actively consume the sugar, causing the sugar level to be lower than usual if it was a healthy individual. Now, if I ask you guys where you can find cerebrospinal fluid, again, there's 2 locations you can find this fluid around the brain, within the subarachnoid space, and within your brain, within cavities called ventricles. That ventricle, the last ventricle, which is 4th ventricle, continue to go down through the spinal cord through a cavity called the central canal. And I'll show you that in just a second as well. So the ventricles, or the cavities inside my brain, are called this larger structure, which I'm going to kind of run over it, called the lateral ventricle. And you have 2 of those. You have this central part right here, your 3rd ventricle. The extension going down right here called cerebral aqueduct. And then this kind of a structure that forms this triangle inside the cerebellum called the 4th ventricle. Again, please do note that the 4th ventricle continue to go down the spinal cord through a canal called the central canal. Now let's go ahead and start by looking at your cerebrum. Again, cerebrum would be the largest part of your brain, which is going to be very important in terms of some of the main functions of who we are, in terms of memory, problem solving, receiving data from all of your senses, creating your motor response, etc. We'll go into more detail about that as we go through the PowerPoint. But for now, let's go ahead and take a look at the anatomy of our cerebrum. So it is the most rostral or highest region of your brain. Again, most superficial aspect of your brain. It does contain 2 hemispheres, and about 80% of the mass of your brain considered to be your cerebrum, which kind of makes sense. Again, just by looking at this picture, you can see the cerebrum is the largest part of your brain, and therefore will be the heaviest aspect of the brain as well. It does cover the diencephalon and the brainstem partially. It does contain both the gray matter and the white matter, as we depicted earlier, which is the dendrites, the unmyelinated axons, as well as your myelinated axons. And in terms of what we identified, and I'm going to be very careful with this word, guys, what we identified as cerebral cortex, the word cortex when it comes to play, this is only referring to the first 2 to 4 millimeter of the superficial aspect of the cerebrum. And this part is only and only going to be cell bodies, dendrites, and the short unmyelinated fibers. Anything underneath that, which is the white matter, will not be called cortex. So cortex is relatively small, guys. It's just the superficial aspect of the brain. Again, only 2 to 4 millimeter thick. Now, if you look at a typical brain, what you see as the most visible structure is your cerebrum, and it have patterns and lines that are really easily visualized. Now, what are these lines called? If we're talking about shallow grooves on the surface of the cerebrum, they're referred to as the sulci. And if there is only one of them, we refer to those as sulcus. So if you look at this picture, you have these lines that are, again, not that deep. So these lines are referred to as the sulcus. However, if the sulcus are identified as deep enough, then we use the word fissure for them. So again, depicted in picture, if it's shallow, that's a sulcus, and if it's deep, is referred to as the fissure. Now, the patterns, the ridges that are formed because of the sulcus and the fissures on the surface of the brain are called gyri, if you're talking about multiple, and gyrus if you're talking about only one. So these patterns you see right here, these kind of bumps on the surface of the brain, those would be your gyri. And again, if you're talking about only one, it would be gyrus. Please, guys, do note again that the first 2 to 4 millimeter of the brain, which is what I'm kind of highlighting right here, that would be your gray matter, which is specifically called cerebral cortex. And anything that is underneath that would be depicting myelinated axons, which are referred to as the white matter. Now, lobes of the brain is basically divided based on also the name of the bones we learned for the skull. So kind of a reminder of the main bones that forms your cranium, the curvature of the cranium. They were frontal, parietal, occipital, and temporal. So based on those, you're also going to get the 5 main lobes of the brain, or sorry, the 4 main brain lobes, which are frontal, parietal, occipital, and temporal. Please do note that there is another lobe that is hidden underneath the temporal. So if you move the temporal, you can see additional gyri underneath the temporal lobe, and those gyri are referred to as the insula. We will take a closer look at what each of these lobes are going to do as we go through the PowerPoint. Now, going back to what I was mentioning earlier, if you look at the brain, we all understand that brain has 2 hemispheres. So the main line that divides your brain to the 2 hemispheres of right and left, that main line is referred to as the longitudinal fissure. And again, it separates your cerebrum to the 2 hemispheres. And then you also have another line that is separating your cerebrum from what we identified as cerebellum. So that line is referred to as the transverse because it's going across cerebral fissure. Please do note that for both of these, we are using the word fissure as a reason because these are deep sulci. They're not superficial. Now, if you look at the main sulci we have in your cerebrum, you have this one right here that is separating your frontal lobe from your parietal lobe, and that is referred to as the central sulcus. And you have one that is separating your temporal from the frontal and parietal lobe, and that is called the lateral sulcus. Now, please do note that when you look at the central sulcus, there is 2 very important gyri associated with the central sulcus. Again, gyri, just a refresher, are the regions of the brain or the patterns or ridges on the surface of the brain. So if it's sitting right in front of the central sulcus, what you see kind of shaded in yellow, is referred to as the precentral gyrus. And again, the area right after the central sulcus is referred to as post-central gyrus. Again, the keyword here is pre versus post. central as a line that is separating these two. Now, if I ask you guys, precentral gyrus is associated with what lobe of the brain? Then your answer would be the frontal. And if I ask you what lobe of the brain the postcentral gyrus will be associated with, then your answer would be the parietal lobe. Now let's take a look at some of the main functions of your cerebral cortex. Again, the superficial aspect of the brain, or the superficial aspect of the cerebrum, which is going to do most of the functions we discussed earlier. So what are the functions they're gonna carry? One of the main functions is sensory. So sensory, if you guys recall from your previous PowerPoint, the introduction to the nervous system, sensory is basically your conscious aware of your sensations. So those would be your sense of hearing, your sense of taste, vision, your smell, sense of touch, etc. You have things called in association area, which is going to integrate diverse information and give you the ability to distinguish what those data actually mean. So these are basically, if I hear a sound, okay, that sound is a car basically honking for me, versus if I'm here, if I'm seeing something, I can say, okay, I'm seeing a person that I've known. I can see that, I can tell you that what I'm smelling is a smell of a cookie versus trash. So that's basically association area. And then for association area, you also have something called multimodal association area, which is extremely important in terms of giving you capacity to do multitasking, problem solving, memory, cognitive procedures, etc. Extremely important. Multimodal associations are extremely important. Last function is motor. So again, remember from your previous PowerPoint, motor implies that data is going out. And we looked at motor and we said that can be voluntary in terms of a skeletal muscle, or it could be involuntary in terms of a smooth or cardiac muscle, or your gland releasing their secretions. So in this case, be careful with this, guys. Cerebral cortex will be responsible for voluntary motor functions, which implies that they are going to be associated only and only with a skeletal muscle. There is no smooth muscle control, there is no cardiac muscle or gland release that are associated with your cerebral cortex. So we already took a look at the lobe, so I'm not gonna go over this again. Now, in terms of your mapping of your body, one of the things that I do want you guys to understand is the concept of homunculus, or sensory and motor homunculus. In this picture, I'm showing you only the sensory. But basically what it means is mapping your primary sensory cortex in terms of your sense of touch. The best way I tell my students to think about it is there are parts of your body that collect a lot of data in terms of your sense of touch. And there are parts of your body that doesn't necessarily get involved in collecting a lot of sensory data, or somatosensory, or sense of touch data. What does that exactly mean? So let's imagine, and don't laugh at my example, but you get punched in your arm versus you get punched in your face. Which one's gonna hurt more? Is your face, of course, right? The reason for your face getting hurt more is because you have more neurons that are collecting data from your face compared to the neurons, number of neurons that are collecting data from your arms. So the second part of this procedure is, if I have more neurons that are collecting data, it means a large part of my brain, or a larger part of my brain, needs to be dedicated to receiving that data. The more neurons I have, the larger area needs to be dedicated to receive that data. Vice versa. If I have my arm that doesn't have much neurons collecting data from it, then I don't need to dedicate a large portion of my brain to receive that data. So let's take a look at it in terms of a picture. Look at this, guys. So you have the leg, not the foot, leg, the trunk of the body, and the arm, which is majority of the space, is only receiving data and is being processed by a relatively small part of your brain. But look at your arm, guys. Sorry, not look at your hand. Even though your hand is a relatively small structure, because there is a significant amount of neurons that are collecting data from your fingertips, then that is going to basically have a larger part of your brain processing that data or receiving that data. Look at this, guys. Your face, right? Face is, again, lots of data is coming from it. So you have a large part of your brain dedicated to receiving that data. So notice what it says. This is called somatic sensory cortex, which is basically the part that is mapping your sense of touch and basically telling you what part of the brain is receiving your sense of touch data. The more neurons you have from that part of the body, the larger part of the brain that is dedicated to it. Now, lips, fingertips are considered to be the largest in terms of their size ratio to the number of neurons coming. But of course, you can also see your face as a whole, also considered to be relatively large in terms of number of neurons. The concept of contralateral, which is the second concept we're going to talk about, is implying that the right side of the cerebral hemisphere is going to receive and send data to the left side of the body and vice versa. So contralateral means one side is controlled by the opposite side of the brain. And we'll see that when we talk about stroke patients and how if the stroke happens on the right hemisphere, then the left side of the body is paralyzed and vice versa. Now, I'm going to stop here for this PowerPoint and we'll continue the PowerPoints from slide 25 for the second part of this lecture.